One of the things that happens, especially when boys and girls play sports, they develop acne in places where the skin it comes in contact with oil and fabric, and it sort of massages that oil and dead skin cells into the pores. The pores become clogged and we have acne. Now, of course, it doesn't just develop in those areas. We can see it on the nose, on the chin, on the jawline, on the cheeks, on the back, the chest even. So it's not just a problem for people who play sports. In fact, acne is increasingly common in adults. We see it all the time. Right, well, I can start very simply. We have a line of products that has some flexibility so that if you're dealing with a child, maybe even because we're seeing acne in 10, 11, 12-year-olds, someone who hasn't kind of gotten their hygiene routine down, we can start very, very simply. We have a product which is called a toner pad. This has salicylic acid in it, and salicylic acid is helpful when we're treating acne because it helps remove those dead skin cells so that they don't become part of the plug in the pore. It also has some anti-inflammatory properties. These little pads can be used even if the kid isn't into a whole cleansing treatment routine, and they're very effective. This is the one I usually start with if we're going to keep it simple. If we have a more comprehensive problem with acne, multiple lesions, constantly healing, constantly breaking out, we really want to talk about the entire program, which is a 4-piece kit. This is our advanced acne system, and we work to develop this with a very reputable laboratory that makes a very popular acne product that a lot of people are aware of. But this system is a little bit different because we've added some glycolic acid to it. The glycolic acid helps us treat a broader range of conditions. In addition to the salicylic acid, which we have in the toner pads, we also have benzoyl peroxide. Now, benzoyl peroxide is not a new ingredient, but it's still one of the most effective ingredients to treat acne because it can get into the pore and introduce oxygen. And oxygen is very effective at suppressing the growth of P. acnes bacteria, which causes acne. Well, it's pretty simple, again, because mostly we're dealing with teenagers, although we do sometimes use this system for adults as well. Step 1 is a cleanser, and again, you have salicylic acid in the cleanser along with a little glycolic acid. We want to keep the skin acidic because keeping the pH of the skin acidic helps us fight off bacteria. The second step are the toner pads, which I showed you earlier. Then we have the benzoyl peroxide treatment for blemishes, blemish gel. And then number 4 is a hydrator. Now, this is the piece that everybody gets thrown off by. A lot of people think, I have oily skin, I have skin that's prone to breakouts, why do I need a hydrator or a moisturizer? It's actually quite critical. Normal, healthy function of the skin requires a certain amount of hydration or moisture. If we don't have that, we get an over-dry condition in the skin, and essentially almost a little tight, dry crust forms. That seals in everything in the pore, and so we get this chronic sort of sloughing, inflammatory, reactive phase within the skin, so hydration is essential. So again, we've kept this simple because we know a lot of times we're dealing with teenagers who may be using skincare products for the first time. So they are numbered 1, 2, 3, and 4 in the order that you would use them. We also have included in the kit, and I'll show you this very briefly, a little cutout card that shows you how you can use all the products both day and night. Just cut along the little perforations and post it in the bathroom. So that should clarify any questions. But basically what you're going to do is you're going to cleanse, tone, treat, and hydrate every single time. So in the morning, cleanse, tone with the toner pads. You're going to treat any blemished areas. You can also apply this for acne that is developing in every zone of the face over the entire face, and then finally hydrate. One of the things that we repeatedly express throughout the little brochure that comes with the kit is that the main thing with acne is that you want to be very gentle and avoid inflammation and irritation to the skin. That's because it becomes a vicious cycle with acne, and so the whole theory about my skin is dirty, it's full of bacteria, I need to clean it like a kitchen counter is counterintuitive and counterproductive to arresting the proliferation of bacteria and clearing up acne. I hear that a lot. It's very frustrating to patients, especially if they never had that challenge when they were younger. They really don't know how to deal with it in their 40s, 50s, and 60s. So we can use the Advanced Acne Kit, but we have to employ a slightly different strategy. Mature skin does not heal as quickly as teenage skin does, and we also have the added challenge that we don't really want to put aside an anti-aging regimen in order to treat the acne. We want to do both of them simultaneously. That's where we have to get very customized because the skin may have some other challenges that we need to address as well. But one of the tools that we often use is retinoic acid. Retinoic acid is a very effective tool at treating young acne, mature acne, and the added bonus for use of retinoic acid as you get older is that it's great for eradicating fine lines and wrinkles and repairing sun damage as well. So yes, it's absolutely possible to have an anti-aging regimen, an acne treatment regimen, all in one. The best combination of all of those products, however, needs to be formulated by a skincare professional so that if you have any other challenges, hyperpigmentation, sensitivity, those can be addressed as well.